I am a hairdresser. I have my own salon for 41 years. Oh, many years ago, I remember I started with severe pain in my left foot. And my sister is a physical therapist, and she touched my foot and I went through the roof. I stopped carrying my grandchildren because of the pain in my feet. I was worried that putting extra weight on my feet would cause more pain. I also stopped walking my dog, which really was fun for me. Recently, I was afraid I would have to quit my job. This is my livelihood, and I've been doing hair since I'm 15. And if I couldn't be in here anymore, I would be very unhappy. Sometimes I start work at 7 a.m. and I'm still in the salon at 7 p.m. I was having to take more breaks, limit what I could do every day, so it would be limiting my income too. I actually had bunions, but my right foot had a hammer toe, and I don't know what you call the little toe, but it was collapsed on its side. I had a toe that stuck up like that. And it was hurting in my shoe. And with every step you take, it hurts. And the small toe, there was nothing I could do with that. It was painful also. My left foot was pretty much completely flat. My foot was turning this way. So I was actually walking on the arch part that wasn't there. So you can imagine how my ankle was. When your feet aren't right, it works up to your knees. I forgot I was ending up with knee issues. My left knee was getting bad. And then I ended up with lower back issues also. So it was to the point where between the foot, the knee, and the lower back, I had to do something. So when I met Dr. Saka, I do remember now, I went there because of the bone spur first. And the minute I met him, I really did like him. I felt comfortable. The bone spur feels like a needle in the bottom of your heel. And you can't walk on it. It's very painful. After a few months, my bone spur was gone. And I was very excited about that. And that's when we started talking about the right foot. We talked about the surgery, what it would entail, and designing my arch in that foot, because I have an extremely flat foot for many years. So I had the bunion taken care of, the hammer toe, and the small toe. And I have a beautiful 20-year-old foot now. I'm surprised when I ask other people when they did have the surgery, bunion surgery many years ago, they say it was the most painful surgery that they've ever gone through. And it took their breath away when they came home. But I had nothing. There was no pain with either surgery. From the day after surgery, actually, which was Thanksgiving, I was able to get around comfortably. My foot didn't hurt at all. This foot, this little toe is totally turned sideways, and the second toe was standing up. And I did have a bunion, so I don't have any more bunions. I am walking better than I walked before. My knee problem went away totally, and my back issues also.
If Dr. Saka was here right now, what would you say to him?
I think every time I went in to visit, have my visit with Dr. Saka, I told him I was very happy and I was excited that I was able to get the surgery for both feet. I just couldn't see quitting my job and walking my dog, and I would say to him, thank you, because, and I have said to him thank you many times, I am grateful. So having a good doctor is amazing. I know now with the foot surgery, I know I can work longer. I want to work at least another 4 years if I can, or who knows how long. One of my goals is to get back walking the dog. She loves to be out there, and I like to be out there. We also go walking at the state park in Locust Lake. And it's not something I want to do in a wheelchair. I prefer to have a nice pair of sneakers on. Even walking on the beach on vacation, when your feet hurt, you don't do that. Walking in the store, you could shop for 2-3 hours. I couldn't do that anymore. There's many limits you have when your feet hurt.